you're actually touching the lives of children, you're touching the lives of mums and dads.
If we can diagnose these children early, then we can intervene early, then we can change the trajectory of their outcome, and that's really important.
It's only through research that we will find the new treatments to cure more children and cure them with a better quality of life.
Last financial year was a record one for the Perth Children's Hospital Foundation. Through the generosity of our donors, we were able to give the Perth Children's Hospital and wider Child and Adolescent Health Service a record $8.7 million. That takes our total contribution over the past 24 years to over $83 million, with a further $25 million committed over the next 5 years. This makes the Foundation the largest funder of the Perth Children's Hospital after government. We're funding the future by supporting groundbreaking research that translates into revolutionising clinical practice. We're funding the best minds available by helping bring the world's best clinicians and researchers to WA, and by ensuring our frontline health staff have access to the best education and training programs available. We're funding the latest and most advanced equipment and technology, and we're funding programs and projects that make sure our young patients and their families have the most positive experiences possible while they receive the very best health care. The difference these funding opportunities make is what drives us every day.
Brain tumours in children rely on gross total resection, or cutting out the whole tumour, for a good outcome. And the only way to do that is to work out how much you've left behind. And the only way we can do that is actually doing imaging by MRI, magnetic resonance imaging. It is a big magnet. Anything metallic will fly across the room. So the space station is basically a box that protects the equipment from that magnetic field. We thought the funding would just help us get the IMRI process going and that it would be safer for our children. But in fact, it's now extended even more. So before this, what we would have to do is keep the pumps out here and extend an extremely long drug line to the child going into the MRI magnet. All of that dead space with drugs is dangerous, because if it flushes through to the kid, they can die. So it is a main safety factor to actually have this pump as close to them as possible in that magnet.
We developed a program here which emulates this system of on-the-ground training, but very much around research. So Sandra is exactly an example of one of these young, bright minds, someone who comes with that fresh passion and enthusiasm, wanting to make a difference.
In this role, I definitely have ample opportunity to work on furthering my knowledge, and I've taken on several research projects through being in this position. I guess the research is so intricate to the field, and the reason why paediatric oncology is where it is in terms of improved survival over many years is because of the research.
Funding from the PCH Foundation has really been critical establishing the fellowship program. Honestly, I wouldn't be able to do what I do without it, and I wouldn't have Dr. Sandra here either.
The project is called Early Moves, and its aim is to identify children who have difficulty with learning, but to identify them very early. The beauty of this study is really that it's a 3-minute video done on your smartphone at home, and that's remotely uploaded to us in a very safe manner, and then we can analyse those movements in detail here in the hospital. By doing this study, if we see those abnormal patterns, we are able to identify those children very early and pull them in when they wouldn't normally have been predicted. And we've already identified up to 4 families in our first 400. Obviously concerned with the results, but have been very pleased to be actually seen and fast-tracked into systems. The impact of this study is that it offers an opportunity for a paradigm shift in how we work, not only here for the children of Western Australia, but for children all over the world, in how we actually diagnose children at risk of cognitive impairment, learning difficulties, and that we change their outcomes.
For many years we've been tracking outcomes from our patients. Burn injury is more than skin deep. And so looking at the psychosocial aspect of the burn care, not just acutely, but long term, and the ramifications is really, really important. At the Stan Perrin Centre of Excellence in Paediatric Burns, we've been able to really start to do research that will have an enormous impact downstream. And we do our very best with what we have right here, right now. But all my life I've been looking out, what else is out there? And so it's fantastic for us to meet Helen. So that she brings a whole different perspective, a whole different lens to shine on our work and say, right, we can now push it further forward. And it's having the time, the energy to be able to do that. And that's why the research funding is so important.
When a child experiences a significantly stressful event in their life, it can have long-term effects, and it can impact actually on every aspect of development. This can actually go on to develop into a psychiatric illness down the track. What we want to do is to help them recover well first up and not have to deal with the consequences down the track, which will then be much harder to shift. When you actually see that child recover, that's the greatest gift of all. You can't get that just from donating to machinery. You have to get that through hard, dedicated clinical research that actually makes a difference to the child's life.
The Artist in Residence program here at Perth Children's Hospital is a really important part of the arts program that we run. Through the funding that the Perth Children's Hospital Foundation provides to the Artist in Residence program, it really enables us to be able to employ professional artists to be able to work with their children, purchase the materials that we require to run the workshops, and ensure that everything that we're doing in this activity is high quality and really a valuable asset to the program. The most important part is that it's designed to improve the health and wellbeing of our patients here at the hospital by providing a creative outlet, provides a positive distraction for patients and their families whilst they're here in the hospital.
The long-awaited bridge linking the Perth Children's Hospital to Kings Park is finally going ahead. The colourful 3-metre wide bridge will cross Winthrop Avenue, allowing sick children and their families easy access to the Botanic Gardens.
Be able to just get out of the hospital for a change, be able to really sort of breathe in the fresh air that Kings Park provides and really get that sense of well-being. That's what we're trying to capture here.
Perth Children's Hospital Foundation's Kids Bridge project that links the QE2 Medical Centre to Kings Park has reached an exciting stage. Design is now complete and construction on site is expected to begin early next year. In less than a year from now, sick children and their families will be able to escape the rigours of medical care and wind their way to one of the world's best nature reserves. We are very proud of this level of funding that we know is making a significant difference to the healthcare of our sick children and young people right across the state.
Funding of clinical teams in the hospital is critically important to do that.
We really couldn't have done it without that funding, where it really provides that protected research time.
You might not realise how much the money or the donation that you give actually helps us keeping the children of WA healthy.